When diagnosing healthcare-associated infections, time is of the essence. 3 experts discuss how advancing technologies can help improve early and accurate detection of a patient's deteriorating condition.
So one of the most difficult things for the clinician is they are getting so much information at them about a particular patient or a particular situation. And in healthcare, while we have electronic health records, those things are not always integrated with all of the systems in healthcare. And so some of the data that our clinicians deal with is in a retrospective mode. If we're able to pull that data together across those silos in a real-time way, it's much easier for the clinician to make those real-time rapid decisions that are needed to provide the best possible care for patients.
Another major challenge in a modern hospital is that we're talking about complex care teams that are comprised of multiple specialists, providers, nurses, respiratory therapists, etc., and multiple care locations. So the patient has to be treated by these complex teams, then transferred and handed over to the next team and the next team and the one after.
New technologies like data science and artificial intelligence save lives. It's that simple. For example, in the condition of sepsis, which claims about 1/3 of the deaths in America's hospitals, where time is life, for every hour of delayed diagnosis, mortality increases by about 8%. Being able to monitor the data 24/7 by 365 and providing indications to care providers at the bedside that their patient may have sepsis means that we can invoke the appropriate interventions as early as possible.
We know that about 80% of the clinical data is actually hidden or embedded within the free text and the narratives. So whether it's going to be a note that a physician takes at the emergency department, or it could be just a progress note during rounding, maybe a consulting when a specialist comes to see the patient and writes their opinion. These are all free text narratives. Advanced technologies such as AI and natural language processing allows us to extract meaningful information from those free text elements and narratives. So if we take that and we add to that all the structured data, such as vitals, medications, specific diagnoses, and interventions, then we can get the full picture of what is happening with the patient.
AI has a tremendous opportunity to improve value. Today, if you meander toward diagnosis, that doesn't help the patient, and it wastes resources. If you meander toward therapy, same thing. So to the extent that these technologies can help us get the right diagnosis and the right therapy as efficiently as possible, we also achieve the best outcomes. That's why we like to think of ROI not only as return on investment, but return on information. And what we're really excited about is the dual bottom line: better care, better value.
So when we look at value, we look at what the outcome is over the cost. And when we think about artificial intelligence and machine learning, sometimes the cost can be significant, but the value in the long run is really important to a hospital and healthcare system. When we think about it from a governance or an administrative CEO perspective, it really contributes to the ability to put in data together and make it information that can be used by the clinicians, but it can also be used by those in administrative roles, those in human resource roles, in order to look at staffing and appropriate resources. So the investment in AI and in machine learning really can pay off significantly in the long run in both financial position and in quality of care and patient satisfaction.
Some of the most important keys for this being successful are the human factors. And that means that the technology has to be credible, it needs to be explainable, and it needs to be reliable. By credible, it simply has to do what it purports to do. And what we hear back from our care providers for our spotting sepsis system is that this is what makes using an electronic health record worth all the effort. Second, in terms of explainability, it has to be transparent. The system doesn't tell the provider that their patient has sepsis. It shows them what the computer sees so that they can make their own diagnosis. That's required by law anyway, but it also increases the transparency. And third, it has to be reliable. As we think of this as a bit of a smoke detector for sepsis, you don't want that smoke detector ringing with false positives, otherwise you'll stop responding to signal. So by training it with thousands and millions of instances, we're able to have very low false positives.
So some of the factors that are very important when you're looking at implementing either artificial intelligence or machine learning in your organization is to make sure that you look at your legacy systems and that what you're implementing actually aligns those systems and doesn't make them more complex and more difficult to use. It's also important to look at trust, because you need to be transparent so that patients, families, and the clinicians and the folks within hospitals and healthcare systems that are using these systems have that trust. And so transparency helps to develop that as we go.
It's not enough to get the AI system to tell us that the patient is deteriorating or developing sepsis. We also need to have the right people on the ground that know what to do at that point. To take the example of a rapid response team, we will need to create a workflow where the AI system notifies the correct person that will then activate a rapid response team. And that rapid response team would use the best protocols that are out there to intervene in real time in taking care of the patient.
So the future frontier of AI is wide open, and it is so exciting. It's exciting for those in administrative and board roles. It's exciting for those at the bedside trying to provide the best possible care for patients and their families. And it's really exciting for those of us in quality. We look at something called STEEP, that is safety, timeliness, effectiveness, efficiency, patient-centered, and equitable care. And when we look at all of those things in quality in healthcare, it's really hard to get data that reflects STEEP in an organization or in a healthcare system. So if we look at artificial intelligence and its ability to streamline and pull data from so many different sources and turn that into actionable information, we are looking at a way to be able to make STEEP come to life in a way we haven't been able to before.
When we're talking about the future of AI and advanced surveillance systems, the future is rather exciting. We're talking about what is also called today precision medicine. And what is that? It's first of all taking the individual unique characteristics, such as their genetic background, their physiology, their history, and then expanding that also to their social environment, family, and community. Adding all of these together with elements such as pharmacogenetics to extend that even, we're able to provide specific care and specific treatment per the individual.
I would love to bring what we're bringing to sepsis patients to all patients, the ability to monitor everything that's important that we collect as a byproduct of care, process that and provide signals back to the care team so we can make the best decisions in real time. In sepsis, we've already proven that this reduces length of stay, it reduces readmission rates, and it reduces cost. And most importantly, it saves lives. We have that capacity for all of the other complex conditions that we treat in hospitals. We have the capacity to advance learning through research, finding new uses of medication. In this way, we won't be practicing healthcare like the movie 50 First Dates. We'll be tapping into our collective memory and learning with each encounter, and in that way, making healthcare better.